leg up a little bit while she gets the photo, okay?
Oh, right.
Yeah, down the hall. Second on the left. Mohammed Osman has arrived. Mohammed Osman is in your house. Mohammed Osman killed Rosa Brennan.
Yeah. Just got to get the video. Yeah. How much can you move this leg? Can we straighten it up a little bit? Can we straighten it down a little bit so I can see your heel? Just a tiny bit.
If I hold on to it, if I lift it up, like,
Ow!
sorry.
Ow!
Sorry, Maureen. Sorry.
I know you are. I know you are. You know what? I was training.
Doing very well. Doing very well.
I will be for it.
If you bring your knee up a little, you might just get that tiny bit of red tension.
I don't think so.
No?
No. No, go away.
Just for one quick go, I'll just move this one out.
Yes, no.
Move this like
No. No. No, nothing else.
and do another
Yeah, it's like flat. So it's trying to tilt her sides back messy. You use the sheet blade to. You want me to do it? Yeah. Don't worry about it. We'll get you back.
We'll get you back comfortable. We've just got one more picture that needs taking.
And then we'll get you back into this position. And we won't bother you.
Again.
Well, again, strong.
Well, we just need to
For a little while.
do the dressing afterwards. We need to redress it. We need to dress it, so yeah. Should I get the big
Yeah.
turn?
Try and keep everyone done and try and get it finished before we have to unsettle you again. When you said what you want us again, so again is a strong word, but maybe we can leave you for a few minutes.
And you found it.
Yeah? Usually I come in, even when I've had some nice days, I come in and I felt alright, but this morning, I got to just as soon as I got into the room, and it just seems to be increasingly getting hotter and hotter all day. It is. And that window open, there's not much good coming through it. But I've been wondering if it were raining, so got to be happy somewhere.
Yeah.
It's the past 2 days it's had that muckiness.
Yeah.
And I thought today was going to be a bit
Fresher.
drier. Yeah.
We needed to rain to do that. I think it's supposed to stay warm for the weekend. We're going to have a barbecue on Sunday. We'll see. We're really this morning, yesterday morning, when I was driving over, I got to it, and it was raining, cloudy, I was literally halfway around the sun. So this is very wet.
Well, sometimes you don't realise, yeah, because it's a common thing for rain.
Yeah. Go everywhere, yeah, it can be anywhere and everywhere, can't it?
So you don't really go into massive wet march.
Mohammed, this is your mama speaking a voicemail. I don't know what is so important that you forget to pick up your sister and you do not answer the phone immediately.
Yeah. It's like clear.
Hello, I just was wondering if you've had any updates about the MRI scan I was referred for.
Once the results come, the nurse will let you know.
Well, not the results, I mean, am I going to have the MRI scan?
And today. The reporters will come around.
Who will?
Reporters,
No, I mean, am I having the MRI scan?
I do not know. If you'll be having it, the reporters will come around to take you down there.
But I need to know, has the radiology team approved the MRI scan? Am I having it?
I'll have to confirm for you.
And also the referral to urogynecology for the clinical opinion, has that been made? Has that been responded to? Thank you. Or if you could ask the nurse or doctor to come and speak to me.
Okay then.
Yeah.
Is it okay if you help me put that?
Oh yes. Do I press this one?
Oh, no.
That one?
The green and the grey.
The green, these two,
Yeah.
like that.
Yeah.
It really is encouraging to look out and see so many faces for Rosa. Teachers, students, past and present. This is something that has hit us all very hard because this is a college that is built on unity, empathy and understanding.
So I just asked the nurse whether I am having the MRI scan, whether the referral has been received, or whether she has any updates about the MRI. And she said, if you're having it, the janitor will come and collect you. And if you're waiting for your results, they'll bring your results to you. And I said, so I had the ultrasound yesterday, but Dr. Maloney's documentation states that for those with a BMI above 30, an ultrasound scan won't show anything at all. And I already had an ultrasound scan, the same ultrasound scan in January, and it did show a residual volume, but not enough for them to do further tests. But in light of the fact that the clinical guidance state that those with a BMI of above 30 should be having a CT or an MRI, I asked the nurse can you please ask someone who knows about my case to come and talk to me about what's happening with the MRI and the whether I'm having it or not, because Dr. Paul said that he was going to refer me and was just waiting for radiology to approve the MRI. And then in terms of the referral to gynecology specialists, which Dr. Paul also made 2 days ago, I said, can you check? And she said she's gone to go and check to see if there's any information on the system about that, because that would be useful, because then they'd be able to review all my medical records, whereas with the private nurse I'm speaking to tomorrow, she's got limited information about this because she won't have any of the blood test results that they did when I arrived, or any of the samples I've done, or any of the history about this. So I've booked an appointment with a nurse, with a reproductive and fertility nurse tomorrow morning from the company DAYE, who are a women's health company. They do hormonal testing, they do all manner of testing for women's health conditions and imbalances and things. So she's a reproductive and fertility nurse, so she'll be focusing on things like your fertility and your reproductive health, and obviously infections can negatively affect that, so it will be interesting to get her take on it, because I haven't yet spoken to anyone who specialises in fertility and reproductive health. Because like infections in pregnancy and stuff can cause miscarriage, and having issues like the issues I'm having can cause infertility if left untreated. So that's why I'm in A&E, because this has been going on for 2 years, and it could sort of severely limit my future, and my son's future as well, if he wants to have any brothers or sisters. So yeah, I'm hoping that the nurse will come back with some information about what's happening. Yeah, Dr. Kazan was going to prescribe me a different antibiotic, but didn't come back or name an antibiotic, which is fine. So I'm just back on the pivamycilin, which is making my chest a bit itchy, but I'm on an antihistamine, so it sort of lowers the side effects, which is good. So I'm pleased about that. That's positive. And yeah, so I need to make an important call now, and I do feel like at some point I should stretch my legs and go outside. You could only make outbound phone calls of up to 2 minutes on the hospital bedside phone, so
Yeah. Do you
yeah.
know who is coming? Yeah. It should never be here.
But yeah, I'm just doing my best to kind of keep checking in with nurses, keep the communication open, and keep asking questions, keep
So you're just concerned about
checking, chasing things up, because ultimately I'm responsible for my own healthcare. And they must have a plan, otherwise, they must have a plan, because like when they did the blood test, my ALT levels were really high, so that would signify that there needs to be further testing of my liver. And the ultrasound didn't show up anything yesterday because of the fact that my weight's too high. So I'm sure they'll be following that up, or they'll be telling me they've referred me to a nephrologist or something, a liver specialist. And then in terms of the proteinuria, that's a sign of something that's leaking from the kidneys. So that would need a kidney specialist or a kidney scan. And the ultrasound wouldn't have been effective because my BMI is above 30. So yeah, I'm just waiting for some more vigorous testing, because there have been abnormalities like whilst I've been here. And then there's also been recent private test results as well, which have come back as requiring urgent treatment. But particularly for the results that they've done that have been abnormal whilst I've been here, like the high ALT, which was 58, and then the proteinuria, I would have thought that it would be those results that whilst I'm here in their department, that their NHS test results, that they would want to do more testing on. So maybe that's what I should be pushing for, really, because ultimately this is urology. So from a urogynecological perspective, until that on-site specialist has come back to us, there's not much more that these guys can do. So maybe it would be a better idea for me to just say, in relation to the high ALT and in relation to the proteinuria, those are urological problems. They're your areas of specialty. And no, clinically, in and of themselves, they don't indicate a clinical emergency. In light of the fact that I've been experiencing these symptoms for over a year, and in light of the fact that my weight is obese, and that's dangerous because that puts me at risk of heart attacks, cardiovascular disease, diabetes and stroke. Can you do some further investigations on those things that you have found that are abnormal in the last few days, that are in your area of speciality and that are evidenced in the test results? So yeah, maybe I'll change my approach, because you have to push for these things, you know, otherwise you have to advocate for yourself. If you just sit on the fence and just sit here and don't say anything, then nothing will ever happen. Because it's time and it's money, and there's always going to be a more emergency case. So you have to advocate for yourself to get the right healthcare. Because otherwise you're just lying in a bed for 4 days, you know, like a couch potato, and you're not really getting anywhere. So, and there's always excuses, like they can say, yeah, but I'm 65 and my ALT is 67, yours is 58, it's not that bad, you know, it's not an emergency. But it's like, it's not a sign that I'm about to have a heart attack, but I'm here for a reason. My symptoms have been going on for a long time. The weight gain has happened very suddenly and very unusually, and so therefore, surely you said nothing's come back abnormal in the ultrasound, so fine, that's okay. So we don't need to do any further investigations there. But in terms of the things that have come back as abnormal, which is the proteinuria and the high ALT, that is something that was abnormal, so that does require further assessment. I just feel like I could do with having like a patient advocate who was here with me, who could sort of, because every single time I'm trying to push for these things, it's almost like I have to go back 2 years to when these symptoms begun. And I also have to evidence like the weight gain and how dramatically it's happened, and how it's not down to laziness, because I've been going to the gym for 7 months, and how it could be a sign of fluid retention, which would be linked with my kidneys and my liver. So therefore, obesity is a chronic illness. It does have very severe risks. It does seriously impede your quality of life. And if it's not down to laziness and inactivity, and if it's not down to eating excessive amounts, which I don't actually believe I do, then maybe it has another cause. And like, if this could have been dealt with through a referral to an obesity specialist, if that had literally ever once been mentioned, then I would have spoken to them about it. But it's literally, my referral to a weight management program or an obesity specialist hasn't ever been made. So, or even a referral to a nutritionist or a dietitian would be useful, because now I'm here. If there was an on-site nutritionist or dietitian who could speak to me, it wouldn't be a case of me struggling alone with no support with a chronic illness and not being able to make the appointment, or not having technical ability to make the appointment. Like, I'm here, so this is an ideal opportunity to get these issues resolved whilst I'm here. And I've got what I should have, this amount of support probably every day. I should have had a carer for years, you know, most people in my position would have had a carer or would have had some support, but financially I'm owed a lot of money and I haven't been able to afford it to be done privately. And there's been a lot of corruption in the public sector, things I've been involved with. So
Is that all right?
yeah, but anyway, I will keep you updated on how it goes. And if they try and fob me off when I mention the high LT and the blood test results, then and the kidney issue, then I will have to just keep asking and keep asking, maybe put it in writing as well. Send an email about it, because it would appear that that might be something they'd respond to more, because gynecological health, there's a stigma around that. Gyno-urological health, there's a stigma around that. It is difficult to talk about. It has been difficult to talk about. But I feel like maybe if I speak about kidney and liver health, I guess there's less of a stigma around those things. So maybe I'll have a better response. But the good news is that I'm on I'm on a new clinical trial, which is good because it's always good to have clinical trials, even if you never really know what the side effects are going to be. You know, I mean, they prescribed me pivmecillin based on not the ultrasound scan. Must be some infection markers for them to have prescribed it to me, otherwise they wouldn't have done. So we'll have to just see if it works, and hopefully it will. And then as for the liver and the kidneys, that really needs to be retested, because I know that they'd say, yeah, but sometimes it fluctuates at different times of the day. You might have done vigorous exercise and that's why there's proteinuria, or there might be a reason for this ALT. It could be a sign of hypertension or diabetes, or it could just be a sign of the fact that you're stressed. You know, but in light of the many health issues I'm struggling with and the chronic pain, I think investigating anything that's come back as abnormal whilst I've been in accident and emergency would be helpful. So I'll try and ask for that again, and I'll put it in writing, and then hopefully there'll be some progression with doing some further tests and investigations whilst I'm here and whilst I'm responsive, and you know, much better to do it now than wait until things get worse.
Mum feels a bit sad. Yeah.
Right, I'm sorry.
sorry, you'll have to have them out of the wound pack. I don't know where they are, and Bianca looked and she couldn't find them either. So you'll have to just take them out there, 'cause otherwise.
That's fine, don't look for them.
Otherwise you
Yeah, that's fine. So if you
do you want it open and
Yeah.
the only way I could, because Scott's busy, so I can't ask you.
She can't stretch her legs.
Elaine,
Yeah?
did you find them?
No, I've just brought a new wound pack.
I'm gonna say I found some. If you want me to get you one.
Please.
Yeah, sorry, open this.
That's
Yeah,
empty.
we're not looking at
The idea of transhumanism, transcending limits via technology is the word of our social divide, those who are upbringing and those who cannot. But perhaps there's a way to bridge the gap. Sometimes it can be very lonely. Really but I don't feel like I'm very detached from others because great artwork for me is like, for example,
What? No, just getting gloves, just trying to get some sterile gloves and then I'll dress those ones as well. And then that is it. Just trying to get find some.
but also these opportunity and that's really beautiful for me and it's like wow, we also relate to how art works so that we can share
Hey, Richard.
Yeah.
Yeah.
like maybe I feel
I opened some vases.
Yeah, no, the one.
Oh, you want the other one?
Yeah.
Is it beautiful?
Really? I wouldn't usually buy it so much, but I've got to go to Lookers at 4 to get my invoice for one of all the cards being written off.
If not, then I can write it for you and then email it. So if you write me your email address,
Yeah.
then yeah.
Is it that one you want?
Yeah, just then if you write me your email address and then get Ruka after you.
get bored and you want something new and shiny. What happens when you want to swap out the tech that you have?
I like it.
You want what? There you go.
Is this so you can get to here? So we need to get to this heel now, Maureen. And it's in a little bit of a position so that I'm not to move you a little bit. I'm going to hold it like this, so
Be
she'll
very
start
quick.
relaxing a little
Sorry,
bit.
sorry.
I'll try and support it so she can just give it a clean and then bob it back on. Or the dress is back on.
Biohackers are passionate about what they do. There are no excuses of pain. Their extreme biohackers no one can left lasting injuries. But the universal hacker instinct, curiosity, drives a lot of things.
Okay,
Yeah,
so
just
just let that
one
dry.
one plaster
Just let that dry and then I'll put this plaster on.
and that bit's done. This will be in a minute. As soon as this dress is gone on.
Hacking, even biohacking, isn't always about grand, world-changing tech developments. Like many genres of hacking that came before, sometimes
sort of a bandage type thing over top, so you think, yeah, one of these. Just goes over your ankle and over your heel, just so it keeps it on. Because the bandage, I wasn't very medical terminology there, was I? I apologise.
That's why I come out with it.
I'm actually hold that in there. Are you doing a cluster on the hair?
I put
Oh, you put a bit.
I didn't dress it, I just put it in, I didn't want to wet it.
Oh, you just give it a yeah. Thing is that on order? Yeah. There you go, Maureen. You're doing really well. Well done. We can leave you alone for a bit now, can't we? Well, just about this back, just so your legs don't get sore together. How do you like it? How's that?
That's it, thank you so much.
Are we letting your husband in now? We better have, haven't we?
Do you want the cheese on this part? The cheese on? Or do you want just blanket? Oh,
It'll be out there. I'll track it down. Don't you worry. I'll find it. This is just to protect your. The other thing.
On Instagram when I showed a kid saying, "Oh, you're going to hell. It's the site of the devil." Would any of those people say that?
want just a blanket on then? Want just a blanket on? Water.
Was here when the nurses were doing it dressing.